Happy Thursday, everyone. Today is November 19th. Thank you for joining me. This time next week, many of you will be home with your families celebrating Thanksgiving. I hope all of you enjoy the well-deserved break, and I look forward to seeing you, both virtually and in person, after the holiday. We do have thousands of disposable masks that we will be handing out before you leave campus, so please look for information on where to get those. SU is still on track to resuming instruction after the Thanksgiving break in the same safe environment that we have worked to maintain all semester long. Based on the messages we've received from students, parents, and others, I know many of you are excited to finish the semester on campus, while others of you may have concerns. We understand why there are concerns, and we don't take those lightly. The health and safety of our campus and community is our top priority. If at any time it's determined that the risk of repopulating campus after Thanksgiving is too great, we will pivot to all virtual classes, similar to our operations last spring. Contingency plans like this have been ready all semester to allow us to do that quickly. Right now, however, statistically, SU is one of the safest places in the state. Our COVID-19 positivity rate has been under 1% for most of the semester. Even with a slight uptick in positive cases this week, SU's rate remains well below Maryland and Wicomico County, both of which are just under 7%. We do understand that spikes in community cases concern some students and families. We recommend that you reach out directly to individual faculty members to ask if virtual instruction may be possible for you following the break. As you know, we are requiring all students, faculty, and staff returning to campus after Thanksgiving to get an SU-administered COVID-19 test between December 1st and December 4th. The location of these tests has changed to Mag's Gym. Again, I repeat, all COVID tests will be conducted the week after Thanksgiving, will be done in Mag's Gym, following CDC guidelines for indoor testing. This testing will allow us to quickly mitigate spread that may result from holiday travel. If you have not already done so, please schedule your test today so you don't lose access to SU buildings and classrooms at the end of that week. The COVID-19 testing dates for the rest of December will be available soon. Okay, at this time, I'll take any questions that you have sent in. Eli, what do we have coming in?
Dr. Wight, the first question is about returning after Thanksgiving. Are you still planning to have students back after Thanksgiving, and why?
Yes, we are still planning to have students back after Thanksgiving, and we will resume the same mode of instruction that we've had all semester long. And the reason why is that right now, SU is one of the safest places you can be, statistically. Our rate of positivity is really low. People are wearing masks around campus everywhere, and the spread of COVID is minimal. Can't say that for the rest of the county and the rest of the state.
Dr. Wight, the next question has to do with holiday travel. What advice or guidance is the university giving to students and employees that decide to travel out of the state of Maryland over the break?
Well, as you may know, the governor has asked if people are traveling to states that have positivity rates over 10% or high caseloads, that people self-quarantine for 14 days after coming back. I think we all have to be really careful about where we travel and what we do when we travel. But if you find that it's appropriate for you to self-isolate for 14 days after coming back, make sure that you are in touch with campus health and with your faculty members to make sure that everybody is on the same page with expectations about whether or not to attend class.
Dr. Wight, can you talk a little bit about the strategies that we're taking to monitor the spread and potentially make operational decisions after the break?
Sure. Well, we, of course, monitor our positivity rate, and we are testing more people now than ever before. Right now, we're testing between 2,000 and 3,000 people every week, and our positivity rate is somewhere around 1 or 2%. When we get positive cases, and there are a few every week, then we do the contact tracing, we reach out, we try to figure out why we have cases and where they arise, and where there are patterns in the data, we try to address things like unauthorized parties and so forth. So we are keeping a very close eye on the health of our community, and we're tracking down the sources of infection to try to stop them. That's why we're such a safe place.
Is there any information that you can provide about what next semester will look like?
Next semester, we think, is going to look very much like this semester. Faculty have already indicated their desire to teach in the 4 different modalities, face-to-face and hybrid and remote and online. We have somewhat more hybrid courses to offer next semester for those of you who value that face-to-face interaction and kind of need that for your education. I know many of my students do. And so we will have the same 4 modes of instruction, but slightly more face-to-face than we had during the fall.
Thanks, Dr. Wight. Those are all the questions for this week.
All right. In the spirit of the season, please know how thankful I am that you've been so diligent in taking the precautions that have allowed us to maintain campus operations this semester. We've made it this far through our commitment to testing, contact tracing, and working with positive cases and their close contacts to get them quarantined and isolated while providing access to resources that they need. We've also been successful because of our students and our employees. Your adherence to safety guidelines, social distancing, good hand hygiene, and mask wearing has been critical in our fight against COVID-19. Your efforts are proof that these measures work in helping control the virus. We've been able to do so well this semester and stay open on campus when others haven't because of your dedication, your hard work, and care and concern for each other. We'll skip our briefing next week because it's Thanksgiving Day, but I'll see you back here on Thursday, December 3rd. Please stay safe and have a happy Thanksgiving, everyone.